KYKS 105, good morning. It is the Merrell in the Morning Show, and once again, we continue our Heart Takeover Day. We've done this now for the past several years with St. Luke's Health Memorial in Lufkin, where we bring about kind of an educational day where we talk about the different types of technologies and treatments and medicines and how you live a heart healthier lifestyle with some of the experts and cardiologists in the region. And I'm proud to say that we have this gentleman back once again. We have Dr. Musa, who is interventional cardiologist and director of cardiac catheterization labs at St. Luke's Health Memorial Lufkin. Great to have you in again. Thank you so much.
Good to be here, Danny. It is a privilege to be able to talk about heart health with the community.
Very good. Well, let's go ahead and dive right into that. And we'll start, first of all, with the partnership with St. Luke's Health Memorial and the Heart Institute of East Texas. They've been partners now for some 10 years. Back in 2013, this began. And since that time, the program has grown significantly. So let's talk about some of the changes, starting, I guess, first of all, with the growth in staff, if you don't mind.
So I think this is a perfect example how teamwork helps build the system for the healthcare in the community. The cooperation between the St. Luke's Health Memorial Hospital administrative staff and the physicians of Heart Institute of East Texas has resulted in our ability to improve the services, the surgery suites, the equipment, and stay current and state-of-the-art, because we could combine resources into building something which is really we are very proud of.
So let's kind of dive into some of the specifics as far as the growth and something like the number of cath labs.
So since 2010, we have increased one cath lab to 3 cath labs. There are 2 state-of-the-art cath labs in the hospital which do full services, and 1 hybrid cath lab, which is not only a cath lab, but in an instant it can turn into an operating room. And so it serves that dual function. So we have 3 inpatient catheterization laboratories in the hospital, and our staff has grown about 4 times in the last decade from what it used to be. And we have a 4th outpatient cath lab at the Heart Institute where the volume has also increased.
I don't know if we could possibly have enough time to go through all the advancements in technology and equipment, because it seems like every year that we do this, there's this brand new modern technology. But let's go ahead and at least take a capsule look at some of these things that have advanced in the equipment and technology through the years.
So we have had major advances in each and every aspect of heart disease over the last few years. So at the interventional cardiology front, we have increased equipment and supplies to support the heart when patient's heart is weak and is failing. So we have assist devices for the heart, like balloon pumps and impeller, which are small impeller devices that can be implanted from the leg and assist a failing heart to improve the heart function and tide the patient over until we can heal the heart with medication and procedures. We have fascinating new balloons which work on the same principle as lithotripsy does and use sound waves to crack the calcium so that we can stretch the blockages open. The intravascular lithotripsy or shockwave angioplasty are the specialized balloons that we use in heavily calcified arteries and open up the blockages that we could not previously get access to.
Okay. So let's talk about, on a personal level, what has been your role, both as a physician as well as a leader of the heart program?
So the biggest thing that I take pride in is to be able to gather a group of physicians and cath lab staff that are highly trained, qualified, and motivated for patient care. And I think that is the key thing, that it takes a team to take care of the patient. No single physician or provider can excel all aspects of it. There's a role for everybody, and it's like a perfect harmony of an orchestra. When a sick patient comes in, everything clicks in, everything falls together, and we all work very fast, stabilize the patient.
So how do you and your colleagues, keep up with the constant growth of staff and the constant growth of technology and everything that's involved with that?
a lot of effort goes into
I bet it does.
The effort goes into the meeting, the organizations, and training and courses and teaching others. So teach the teacher, and the teacher teaches the others.
And let's talk more about that education and the training. I mean, how much education in there, how much of an emphasis is placed on that so that you can have that education for the prevention and for the early detection of heart disease?
So the physicians of the Heart Institute over the years have provided tremendous amount of education to the community. We've been to the high school and middle school. We go to the Rotary clubs and the Lions clubs. We do the walk with the doc once a month for getting the exercise emphasis out to the community. We have a grant to bridge the gap of education in outlying communities which are difficult to access. And we go to communities surrounding Lufkin and educate locally. We do health fairs, we do education things, and we have a great thing, a mega heart coming up.
Right, yeah, I think the 24th, right?
On the 24th, yes.
All right, so education plays a big part in this. You know, some words that have really kind of been used a lot over the past, especially the past few years. You've heard the word epidemic, you've heard the word pandemic, but really, I mean, you go back to the 1960s and 70s, heart disease was basically classified as an epidemic then. And so where are we at today?
So the incidence of heart disease increased over the 60s and 70s and 80s and then plateaued. The mortality from heart disease actually started improving in 80s and has stabilized now, and the mortality improvement in decreasing mortalities have plateaued. And unfortunately, that has come to a point where the only thing we can improve now is early recognition. And the key to early recognition is community awareness. Yeah, that's where the community education comes in. So education both for the preventive measures and education for knowing the symptoms early enough to come to attention. So there is a program at the American College of Cardiology. It's called EHAC, Early Heart Attack Treatment. And the EHAC is a program where you can log on the internet and you can learn about the symptoms, the preventions, and what steps to take if you think somebody's having a heart attack. The next step of improvement in heart care would come from improving the prevention and improving the outcomes by earlier intervention when somebody's having a heart attack.
Right.
And that's where the emphasis is now.
And so taking it even a step further back than that, as far as the education and, you know, educating people about the risk factors. Let's talk about some of the risk factors that, you know, that a person can modify to help them live a better lifestyle.
Yes. So there are some risk factors that are non-modifiable, like the male sex. You know, the earlier, less than 65 men are more likely to have a heart attack, or your family history or genetics. But most of the major heart attacks are modifiable and controllable. The biggest, most common is high blood pressure. So high blood pressure leads to increased risk of heart disease, strokes, and heart attacks.
Right.
And the blood pressure can be controlled relatively easily in 95% of the patients. There's a lot of medications out there. There are a lot of non-expensive medicines out there. And there are different types of medicines, even if you have side effects from one or the other or the third or the fourth or the fifth, we can go down the class.
Sure.
And there are different classes of medicines available. So this day and age, we should be able to control by far the 99% of patients with blood pressure with low cost and total lack of side effects.
Okay. So that's out there. And this is, I know Tina from St. Luke's Health Memorial has put together kind of almost like a little game here for us, where we're going to play a round of heart fact or myth. So I'm going to shoot out some subjects at you, Doctor. And if you don't mind, let us know if this is truthful or if it's not truthful, and then you can kind of expound on each one of these categories. So we'll start with heart attacks. And all heart attacks have the same warning signs.
So this goes to the early detection of the heart attack. So most of the heart attacks present with chest pain, pressure, or heaviness or tightness in the center of the chest. But sometimes the pain is between the shoulder blades, and sometimes the pain is only down the arm or in the jaw. And at times there is no chest pain. The only indication of something not being right is feeling weak, tired, nauseous, undue shortness of breath, excessive sweating, excessive fatigue. Those unexplained symptoms could all be symptoms of an underlying heart attack. So that is not true that all heart attacks present the same way. In fact, even the chest pain is not the same in different patients.
Right. Okay. Move on to the next one. All right. So as we all know, young people are invincible, of course. At least they think they are. So young people really don't have to start worrying about heart health until they get older. What do you say about that?
So the heart disease is commoner in old people. So 65 and above, your risk of heart attacks and disease goes up. But having said that, 30% of all heart attacks happen in people of ages between 35 and 50.
Really?
So it is never too early to start thinking about your heart health. So to go back to your blood pressure control, to monitoring your cholesterol, to looking for diabetes and its treatments, smoking cessation, and regular exercise, those are the cornerstones of the early detection, prevention of heart disease in younger population.
Let's talk about gender here. Heart disease affects men primarily.
So it is true up to the age of 65.
Okay.
So in middle-aged and less than 65-year-old populations, heart disease is predominantly seen in men. But as the population ages, the women start catching up, and after 65, they very quickly become equal.
Okay. So let's kind of do this. I've heard people say in the past, that there's really nothing I can do because my mom had heart disease, my dad had heart. It just runs in my family. There's nothing I can do. There's no way to prevent heart problems if you have a family history of it. How true is that?
So that is more complicated than that.
Okay.
So there's true the fact there's some genetics to it. But having said that, a lot of those genetics are transmitted through secondary factors like you have family history of high blood pressure and family history of high cholesterol, family history of diabetes that were not properly controlled in the prior generations. Uh-huh. So at the current time, we can control all of those risk factors and modify them and eliminate them so we can tremendously improve your risk for coronary artery disease and heart problems and modify your familial risk.
Okay.
And decrease it.
Makes sense. What about heavy drinking? Some may be prone to say, well, heavy drinking, that affects my liver, not my heart.
So alcohol has a direct toxic effect on heart muscles.
Okay.
With excessive drinking, the heart muscles metabolism gets affected. It becomes more fatty muscle, less muscular and more fatty. It gets flabby, and this power to squeeze diminishes and heart becomes weak and enlarged. There's an entity called alcoholic cardiomyopathy from excessive drinking, a congestive heart failure, which is an enlarged, weak, and a baggy heart that cannot squeeze. And you have congestive heart failure.
I did not know that. Okay.
So alcohol is a toxin for the heart muscle.
So this is, I think, a pretty common thing that folks will tend to talk. I had a little palpitation, or it felt like my heart was out of rhythm for just a few seconds, known as irregular heartbeats. Are they pretty much harmless?
Not necessarily. So any irregular heartbeat which is new and any irregular heartbeat which occurs frequently or sustained or lasts for a period of time or runs more than a few minutes could potentially be serious.
Okay.
There's a whole range of irregular heartbeat or irregular heart rhythms which range from being very benign and innocuous to very serious and life-threatening, and certainly needs to be assessed. So if they're persistent and if they happen frequently, they need attention, and you need to seek medical attention and have them evaluated.
So, yeah, as you mentioned, if somebody has never had something like that before, and say it happens for just a few seconds, maybe don't sound the alarm just then, but if it continues to happen, then maybe so?
Yes, definitely.
Okay, very good. Well, thanks for playing this little game with us here. So, I mean, what else would you like to come across with as far as any sort of parting thoughts about what it is that you offer personally, what it is that this East Texas community can gain from all the different technologies that are out there and offered?
So let's go back to 3 things. 1, risk factor modification. And I will come back to the lowest hanging fruit is smoking. So use of tobacco is very common in East Texas communities, sure. And use of tobacco is almost a macho thing to do, and that is something that we can make a difference in. Okay. Nicotine is addictive. There are brain receptors for nicotine that give us pleasure. They're normally occurring nicotine in our system. So the nicotine addiction is not to be underestimated. But having said that, the only way to quit it is by somebody wanting to do it. There is no magic to it. Mm-hmm. Once you want enough to get rid of it, you can stop using it. Whether it's chewing tobacco or whether it's snuff or whether it's smoking or vaping, they're all equally as bad for your heart. And that is the lowest hanging fruit in the community we can do by quitting smoking. Okay. Cholesterol, the diet, the dietary habits, the fried foods, the excessive fatty meats and saturated fats in our diet. We need to lean towards poultry. We need to lean towards baked foods. We need to lean towards Mediterranean diet and seafood and fish, mm-hmm. and more vegetables and less meats. Okay. Diabetes. If we have diabetes, there are a lot of medicines these days. There is increased incentive for pharmaceuticals to lower the cost of some of those medicines lately. And we should control our diabetes and follow our blood sugars. After controlling our risk factors, the second most important thing is EHAC education, early heart attack care education. And if you have symptoms, don't put it off. Right. Time is money. The heart attacks in the first 2 hours progress like a wavefront does. And the earlier we intervene, the more heart muscle we can salvage. So when we recognize a heart attack patient coming in, we activate a multitude of teams in the cath lab. And everybody gets there, and we rush to the cath lab and try and intervene and stop it as fast as we can. We need the same thing from the community to recognize heart attack happening in themselves or their loved ones and get them to the medical attention sooner. Okay. And did you have a third, or was that the 2 that you wanted to talk about there? That's it. Okay. Very good. Outstanding. Well, once again, Dr. Musa Khan, it's always a pleasure to have your insight, and thank you, as always, for your vision, your leadership, and, of course, thank you for giving so many people giving us hope. Appreciate it. Oh, thank you so much for having us here.